Hello, it's me again, Dr. Malka. Today I'm going to show you how to self-treat sciatica syndrome, which is also called piriformis syndrome, or symptoms such as numbing, tingling, shooting, or pain symptoms that start in the buttock area. That's the key. It starts in the middle of the buttock and goes down the back of the thigh and possibly into the calf and the foot if it's really bad. The piriformis attaches to the sacrum. That's that triangular bone just below the low back, and then crosses to attach to the upper thigh bone. The sciatic nerve exits the spine and can travel through a tight piriformis, which can then squeeze on that nerve, causing the symptoms going down the leg. These symptoms can also be caused by disc herniation or arthritic changes, but that's rare. The referral symptoms can also come from the back muscles. If you have symptoms down the front of the thigh, it can usually be caused by the low back muscle called the iliopsoas. For treatments of these muscles, please click to the low back self-care video below. If sciatic syndrome is an ongoing problem for you, after the self-massage and stretches, I will show you exercises to stabilize the hip region in order to prevent flare-ups in the future. Do the massage in the lying down position. This way the muscle is relaxed and it'll be easier to massage that way. So I already showed you on the chart, but the muscle starts here. You'll feel this triangular bone and drop off. The muscle starts here, goes across the buttock, and attaches down here in that hip area. So bringing the theracane, you start at that bone and again push up into the muscle, sliding down, diagonal towards the hip, and push up using the torque. At some point, if you feel that referral down the leg and you do kind of want to search for that, go ahead and hold it up to even a full minute. At some point, you can do cross back and forth motions with the theracane as well. That's cross fiber friction. And just continue all the way down to where the muscle attaches to the thigh. And you may want to even have to roll over onto the theracane to really get into that muscle. To stretch the piriformis muscle, let's say it's on the left. Want to cross the thigh over like this. We call this the figure 4 stretch. Reach through the thigh and around the outside of the thigh and clasp behind the knee, pulling the knee up towards the face. And you should feel this stretch. And then you want to maybe lean over to one side and then kind of lean to the other side until you find where you feel the stretch the most. If it's on the right side, put the left leg down, bring the ankle across the knee. Again, reach the right hand through the thigh, the left hand on the outside, clasp behind the knee, and pull the leg up to the face. And again, wiggle around and feel where you feel the stretch the most. You may slide over to the left or come over to the right. And hold this for a full minute or up to 2 or 3 minutes even. If you don't have the luxury to do this stretch lying down, maybe you're at work, there's another way to do the exact same stretch. It's almost like a jar. You can unscrew the jar from the top or from the bottom. Once again, same thing, just figure 4 with the leg, outside of the ankle, on the top of the knee. Put your hands on your legs and then just drop down. And again, kind of twisting and moving until you feel the stretch. And this stretch, you can come all the way down and stretch. And then on the other side, let's say your right side is affected, put your right ankle across the knee. And then again, pushing this leg down right here, the knee. Bring your head forward and down and stretch it. Once again, you can kind of turn from one side or to the other side to see what stretches the best. So let's continue with pelvic stabilization exercises. The whole concept of pelvic stabilization exercises is to get all the muscles working together in balance. And the first one I'm going to show you is a pelvic tilt. So you'll want to bring your belly button into your spine, so essentially you're tightening your stomach muscles, you tighten your buttock muscles, and you're just going to tilt your spine, pushing your low back into the table. And if you have a lot of pain, maybe this is really all you can do. Tighten the stomach, tighten the buttocks, and tilt. And then when you feel comfortable, tighten the stomach, tighten the buttocks, and come up. And you want to keep your elbows off the floor. And you want to create a really nice straight plank. And at any time this hurts your low back, just back down. So here we are at the top of the position. And then as you come down, vertebra by vertebra by vertebra, and the buttocks is going to be the last to touch. And then we'll relax, start this again. Tighten the stomach muscles, tighten the buttock, pelvic tilt. That's pushing the low back into the table or the floor, creating a flat spine. Coming up first with the buttock, and then slowly bringing the spine up from the low back up to the mid back, and then up. And I actually call these tushy pushies. That's my cute little nickname for them. And then come down slowly, slowly, and be aware of the control. If you're jittering around in the hips, you really want to kind of lock them in. And then the buttocks is the last to drop down. Again, tighten the tummy, tighten the buttocks, roll the pelvis, and come up, starting with the buttocks. Squeezing that buttocks, and then up, and then you're even now. If you're at this point and you feel pretty comfortable, you then want to, with 1 inch, lift the right leg off the table. Now when you do this, if the hips start dropping, then peel back and then just do the bridging exercises. But if you're stable with that, then bring up the left, and then down, just 1 inch. And this really tests your balance. Once you feel comfortable marching back and forth with that, you can then lift the leg up, straighten the leg, hold it, bring it back, and then down, and then bring the other leg up, straighten it, bring it back, and then down. Now if there's any pain during this, again, peel back and maybe just continue with the bridging exercises. And this really creates a weight belt where it just locks in all these muscles so they work together. And then down. So the next stabilization exercise will help to balance out the mid-back and the low back. So you're going to start on all fours. Your shoulder joint is going to be right above your wrists, and the knee is going to be right below your pelvic bone. And then you want to bring the right hand up and the left leg back. The bottom leg, the toe should be pointed just to create a little more need for the body to balance out. But this should be a straight line, and the leg should be a straight line. It shouldn't be up and it shouldn't be down. The idea with stabilizing here is that everything is in alignment, and that creates challenge in the body. And then switch, bringing the left arm up and the right leg back. You can point the toe or just drive the heel back. And again, it should be a nice straight line. And the head is just looking down. And then switch. You can hold this for 10 seconds or up to a minute. Whatever your comfort zone is. And then bring this down. Left arm up in a nice alignment. Right leg back. If you curl your toes under, you'll create a little more stability, but you really do want to, this is a balancing exercise, so it's better to keep the toes straight. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos. To allow me to make more videos for you in the future, please press the subscribe button, press the notification button so you don't miss a video, and press the like button, and be sure to share with your friends and family.